Good afternoon to everyone, and welcome to this session, Managing Sickle Cell Disease, Improving Doctor and Patient Dialogue, and Breaking Down Barriers to Care. My name is Lester Holloway. I'm editor of the Voice newspaper, and I'm moderating and chairing this session. I'll introduce our very special guests in just a moment. The Voice has been sponsored for this session. And I'm very excited about this very, very important discussion that we are having here on World Sickle Cell Day. I'll introduce our guests in just a minute, but a word about the whole session to put everyone fully in the picture. The disease awareness campaign Code Red has been created and funded by Novartis Pharmaceuticals UK Limited. This Facebook live stream is part of the campaign, and all participants of the event have been engaged by Novartis in relation to the campaign to share their story. Unless stated otherwise, the content that the participants post or talk about is their own, and any materials which relate to the Code Red campaign have been approved by Novartis and are labelled as such. So with that disclaimer done, why are we here? Well, we're here, as I mentioned, because it's World Sickle Cell Day. In the UK, we have 15,000, an estimated 15,000 people living with the condition. A very large proportion of those are African or Caribbean in terms of having sickle cell trait, a vastly greater proportion than some other ethnic groups, although all ethnic groups can have sickle cell trait. And this session is really about exploring improved communication between patients and medical professionals, and basically how we can lead to better outcomes. The slide you saw right at the very beginning, which I'll also show at the end as well, is about Novartis's Code Red campaign. They've got a special microsite which they've launched, which I'll also mention later, but the website address is all the W's, switchuponsicklecell.co.uk, and that's a guide to assist conversations. A little bit of housekeeping. There are no comments on the Facebook, on our Facebook, because any reference to any drugs will cause a bit of a headache. So this applies to our speakers as well. So if you refer to any drug or treatment, please do not mention the product. And so, as well as communication, we also want to talk about how we increase the understanding of sickle cell, and we aim to finish at 1 p.m. So, without further ado, let me introduce my very special guests. First of all, we have Victoria. I'm not quite sure how you pronounce your surname. How do you pronounce your surname? Econoy. Okay, I didn't want to get that wrong. Okay. Victoria is a star of stage and screen, British actress and singer. She's best known for a regular role in ITV's Coronation Street and The Royals for 4 seasons. And since leaving Coronation Street, she's starred in BBC's Death in Paradise and much more besides. She's also competed on Celebrity X Factor as a singer, but is very much a rising star of stage and screen. And this year, I understand, she's going to star in her first feature film. She's also spoken about living with sickle cell, and I'm honoured to be joined by her.
Thank you for having me.
Absolutely, really delighted that you're here. Also, Dr. Shivan Pancham, wearing the red, is a consultant hematologist with Sandwell and West Birmingham NHS Trust. Dr. Pancham is the lead clinician for the West Midlands Sickle Service. She's also been a member of the writing group for the National Sickle Cell and Thalassemia Guidelines. And last but not least, Michelle Salter is chair of the Sickle Cell Society UK. Michelle has had a successful 30-year career in healthcare finance. She's held Director of Finance roles in London, Hertfordshire, Essex, Lincolnshire, where she's provided financial leadership to hospitals, community, mental health, primary care, and academic health science NHS organisations. got through that without losing my breath. And since 2014, Michelle has been she's been vice chair, sorry, of the Sickle Cell Society and treasurer, and then she was promoted to chair this year. So welcome to all of you. Michelle, if I can start with you, briefly, can you explain to us what sickle cell is and what physical and emotional impact having sickle cell has on those who are living with it?
Yeah. So sickle cell is a condition which individuals are born with. So it can't be contracted from somebody else. And both parents actually have to have had the trait or the disorder itself. And it's an invisible disability because everything's happening internally. It's the red blood cells, which should be nice, round, spongy, donut shaped, carrying all the oxygen to all the vital parts of the body. But the term sickle comes from the fact that when individuals go into a vaso-occlusive crisis, these round red blood cells actually become hard, sticky, rigid. They're not carrying oxygen. Furthermore, they're causing blockages which stop the other healthy red blood cells from also passing through. This results in excruciating pain levels, which I'm sure Victoria can talk about when she talks about her own personal experience. So physically, it manifests very frequently in very acute pain, which people have described as being worse than childbirth, like blazes of glass trickling through their veins. It can also, if it's not treated successfully, lead to further complications. So as well as the physical aspects, obviously that's going to play havoc with your mind. If you think about when we watch episodes of women in childbirth, they're screaming, they're emotional, they're exhausted, and that's happening to you on an unpredicted basis. So again, that's going to cause havoc emotionally. It interferes with children's development and playing with other children, education, missing school, and retaining employment and work. So again, in addition to the actual physical elements, this is ongoing 24/7. So although it's an invisible disease, it's a very devastating and debilitating condition to have.
Tell me a bit about the Sickle Cell Society itself, in a nutshell.
In a nutshell, well, we do a lot. We were created back in 1979, so just over 40 years, very much in response to the topic that we're talking about today. It was a recognition that there wasn't sufficient understanding around the condition, and a group of patients, parents, and health professionals got together to create the charity to basically say we need to do better, and we need to have much better provision to basically make the quality of life for individuals as best as it can be. There has been progress in the last 40 years, but as we can see today, and on World Sickle Cell Day, we still have so much more that we can do and are doing.
And how much progress do you think there's been since the No One's Listening report?
The No One's Listening report actually has been such a fundamental change in the conversation. It sadly followed the death of Evan Nathan Smith, who died basically, it was a preventable death because he didn't receive a blood transfusion quickly enough, even though he was within a healthcare setting. The Sickle Cell Society have been obviously lobbying for changes for a long time, particularly around education in terms of healthcare professionals. The haematologists and specialists are fantastic, but it's basically areas, particularly around the it was called first responders. So people taking the 999 calls, the ambulance crews, the paramedics, and basically ED emergency departments not having sufficient understanding. So the No One's Listening report was basically done through the Sickle Cell and Thalassemia All-Party Parliamentary Group. It's chairs Pat McFadden MP. And it took testimonies of individuals and their experience through healthcare, but particularly trust and that emergency setting.
Okay.
Harrowing stories. And as a consequence of that report, which you can find on the Sickle Cell Society website, there has now been tangible change. There was a meeting with Pat McFadden MP, John James CEO, with the Secretary of State, Zavid Javid, who's given a personal commitment in addressing the health inequalities highlighted. So really exciting.
Yeah, thanks so much, Michelle, and we'll flash up your website again at the end. So please, if you're tuning in, then just do take a note of that, or have your pen ready to take a note of the Sickle Cell Society's website, and indeed the Switch Up on Sickle Cell campaign. Victoria, if I can turn to you, you've spoken in the past about living with sickle cell. Can you tell us a bit about your experiences of living with sickle cell, and how does it affect your life?
I guess I'd like to say that I feel lucky with my experiences of sickle cell, because I've seen just how debilitating it can be for other people. It has affected me in a lot of ways, in particular throughout my pregnancy and the birth and the aftermath of the birth. But growing up as a child, we were told that the pains I was having were growing pains. I did a lot of sport, which a lot of children with sickle cell can't really do. And my mum was a carrier, my dad had the full thing. So I have HBSC, which is a slightly milder version of the HBSS, which is obviously the one that we know to be so debilitating so many people. And so for whatever reason, I was able to do a few more things, I guess, and operate in a more normal way with the way the other children were. And so once we were told that, I guess you just take that as gospel and just carry on your life. And okay, well, this is just what happens to me when I do this sport. These pains that I'm having are just because I'm exerting my body. And to be fair, there were a few times where I kept it from my mum, just how much pain I was in, because I didn't want her to pull me from the sports teams that I was a part of. And it wasn't until I got to in my early 20s, and I was working out in a hot country, and not knowing how much how much my type of sickle cell was affecting me. I guess I wasn't looking after my body in the way that you really, really have to when you have this condition. And I had a really bad crisis, my first real crisis, where it couldn't just be brushed off as something else, something small. I was in a hell of a lot of pain. I had to go to the hospital, get morphine injections for the pain. I had to quit that job that I was on, come back to the UK. And that was when I saw an incredible lady called Professor Fortune. And she spoke to me about just how serious the condition was for me. And actually kind of hidden, and sometimes, I guess in some ways, a little bit more dangerous, because if you're not fully aware of the importance of it and how much it's actually affecting you, then you're not making the correct changes. And I think that for me, that was a turning point. I got very unwell in 2014, and that for me was kind of the turning point in my life, and I had to make a lot of changes. Really look after myself. And I say lucky, and maybe it's, I don't know, maybe it's an odd word to use, but I do see, and I've spoken to, and being a patron of sickle cell charity, I speak to so many people, and I see just how much this, takes over their lives in a way that I've not had to endure. And it's heartbreaking, because it is the invisible condition, as you say, and so many people are affected in every aspect of life, whether that be work or socially. It can feel quite lonely, I think, to have something that nobody understands, nobody quite gets. You don't always want to talk about it because you don't want to be seen as different. I remember keeping my condition from my colleagues when I was in The Lion King. Nobody knew, and it was 8 shows a week. So my body was under a lot of pressure. But at the time, I think you just do what you can to survive and to push through. And I feel I'm so grateful that I spoke to the right people to put me in a different mindset of, actually, you didn't ask for this. It's not something that you chose to be having to live with. And there's so much out there, which is what this is about for us today. There's so many resources, so many places you can go. The community support is out there. You just have to know where to look for it.
Just unmute myself. Yes, absolutely. Right, talking about it being an invisible condition as well. We carried a feature recently in The Voice talking about sickle cell and dating as well, and the dilemma that people who are carrying the trait go through about whether to mention it, whether to not mention it, and when to do so, and so on. So there's a hell of a lot there to discuss. But I wanted to just direct things a bit more to, in terms of your experience in dealing with healthcare professionals, really, since it's first discovered until now. How have you really found that communication?
I guess it's been a positive and a negative experience for me. Positive because I've found out so much more. I've educated myself and I've been able to get that information, I guess, by just having, my hematologist is just incredible and really looks out for me, looks after me, understands my, I guess, slightly different life and lifestyle because of my line of work and how I have to try and incorporate all of the things that comes along with having a chronic illness like sickle cell. So I have him and that, I have all of that information there, and that's been incredible. But there have been times in the past where I've gone, as you say, to A&E, and they just, unfortunately, the education just hasn't been out there in order to equip them with the knowledge of how to deal with somebody that doesn't quite fit the box that you're safe with, that that you feel safe with, that you understand how to treat. And I have had experiences in the past where I think it feels like they think you're putting it on a little bit because they don't quite understand how you could be feeling all this pain. You don't have a broken bone, there's no open wound, all of that kind of thing. But actually, again, what we're doing today, and hopefully what we can do going forwards, will educate everybody, even people with sickle cell. There's always more to be educated on. I'm certainly learning all the time in these discussions, with the discussions I have with people who have a harder time with the condition. So I do think that there is this huge need and this gap this void that needs to be filled of education and understanding, and therefore the empathy that you need having a chronic illness that is so under-recognized, I guess.
Absolutely. And of course, education for healthcare professionals, I think you also touched on that, is absolutely important to understand, and recognize the condition. But do you think it would have been helpful, at the start, to perhaps have some advice about how yourself, to communicate with healthcare professionals and make them realize that this is something that they should be taking extremely seriously?
Yeah, for sure. Because if you're in whatever the situation, you could have had an accident and you're, as we know, we bleed more with sickle cell. So that could be the situation. It might not be a crisis where it's just pain and therefore they're not understanding, but just that in itself, that wound needs to be looked at in a slightly different way because there's that little bit more urgency. And so whatever it is, I think knowing how to communicate effectively with the healthcare professionals, with the care providers, is crucial, because it can be life-saving, life-changing, depending on the situation. So I think that education on our side, as well as the healthcare professionals, as well as Joe or Jane blogs in the street who doesn't know anything about it and could be passing you, you know, I don't know, you're on your way to somewhere and something happens and you're in a situation and nobody knows how to deal with it. You know, you get these first aid responders, and they're trained in certain things that I feel like how to deal with somebody with sickle cell, having that implemented into the first aid training could save so many lives. But I understand it's a process, and hopefully we can be at the beginning of that and pushing to make things easier all around for everybody involved.
Absolutely. I'll come on to Dr. Shivan just in just one moment, talking about building effective and collaborative, relationships between patients and healthcare professionals. But if I could just quickly go back to you, just very briefly, Michelle, just for a perspective in relation to Black sickle cell sufferers when they're having a crisis. Is there any issue about healthcare professionals, maybe not recognizing pain as much because of their own attitudes?
Oh, it's a huge issue, we've known about that for a long time. The fact that particularly young Black men being accused of being blood addicts, so they're phoning up basically 999 because they want a fix, not because they've got sickle cell. And even when it's believed that they've got sickle cell, as Victoria has described, the level of pain is not understood, so they believe it's exaggerated, and they would issue painkillers at very low thresholds and not really be listening to the individual who knows that what they need is strong opioids. That's why they're calling 999 as a last resort. Most individuals will try to cope with their pain at home. So there is a stigma about, as I said, particularly if you happen to be a Black male, but also we know if we relate it to Black women in maternity services, this myth that Black people can hold their pain better. So there's so many issues within the health service that we are talking about now, finally, and we just need to ensure that we're being heard.
Absolutely. Dr. Shivan, if I can come to you, obviously you're from Sandwell and West Birmingham NHS Trust. What's your advice for building effective and collaborative relations between sickle cell patients and healthcare professionals?
I'd like to start off by saying, the stories we hear from patients are really heartbreaking for us as, healthcare professionals working with patients. We have lifelong relationships with our patients, and the stories all too often we hear are distressing for us, much less for our patients. And the key, I think, is to have an open and honest dialogue and discussion with your healthcare provider, between healthcare providers and patients, and there needs to be a trust. There may not always be, there will always be differences of opinion, but it's getting that mutual understanding, working towards a goal. So we can look at various settings. So it may say, for example, in a hematology clinic or in a hematology day unit, working with your patients to decide on, well, is something working, is something not working? How are we going to deliver, whatever treatment therapy for you? So that is one that I think as a hematologist we have some control. I would it's so nice to hear Victoria talk about education on both parts, and one starting point would be for our patients to have an understanding of the illness. What is my hemoglobin level normally? What is my normal kidney function? What is my normal level of bilirubin? What are the things to sort of look out for? An idea of what the pain plan is. This is what I normally have. And the recognition that, in an emergency, you may not be well able to articulate that plan. So have your pain plan written somewhere that you can take with you. So if we look at the emergency setting, which I think unfortunately far too often where things seem to break down, we hear sometimes that patients go to hospital with their pain plan, it's there and things are not followed, and there is certainly so much work to do. And from healthcare professionals, to realize that somebody in pain may not be able to articulate their history, adequately. So having that open dialogue when things go well, when things don't go well, but I think trust is absolutely essential to getting. I said it's a long-term partnership.
So what do people do in those circumstances? You're at A&E. You've got your plan to hand, but still not being listened to. What are the things that the patient can say, or the tactics they can use to actually get the treatment that they deserve?
Difficult question, Lester. And I think it is, when you are in ED, you are not there, you are there to get professional help. You are there because nothing else, there is no resort to managing your pain. So it is, again, perseverance in that really difficult situation. And I think it is hard. And the healthcare community, via the outcomes from the No One's Listening report, there needs to be so much more work done in that frontline setting, so that there is empathy. I always say to people, it shouldn't matter if you have pain from sickle cell disease. It's no different to managing pain from a heart attack, or pain if you have a surgical problem. Pain is pain, and just basic empathy, I think, goes a long way. So it is it is an emergency. The NICE standard is pain relief within 30 minutes. That is what you are there for. And we work with our ED department now to feed that back to them. Again, it's work in progress. It's not all, it's imperfect a lot of the time, but it's again that sort of again working with ED to say, I need my pain relief. I need my pain relief. I am in pain. I am in pain. I might be frustrated. I am in pain. Just give me my pain relief, please. And call my hematology team. So if it's within working hours, call my hematology team. Say, for example, they know me. They will be able to come, give me the right sort of treatment. But again, if someone says to me, what's the one thing right now, if I just had one wish to make things in sickle cell disease better at this point in time, I would say is just get that emergency department pathway right for all patients, because that's when our patients are at their most vulnerable, the greatest hour of need, and it goes wrong so often.
So what needs to be done as far as healthcare professionals are concerned in A&E? I mean, is there sufficient training and guidance at the moment? And if so, if not, how can that be improved?
There are several learning tools available. Each hospital would have their own training program. So part of the work of the hemoglobinopathy coordinating centers is to deliver that training. The tools are there, but it is for people to participate in that training. You can make all things available. They need to sort of take part in that training. And I know one of the recommendations from the No One's Listening report is to have dialogue with the Royal College of Emergency Medicine. And I would love it if it is a mandatory part of training for emergency departments, that everyone from porter to consultant has some training on sickle cell disease. So for an emergency department, it could say for example, be a healthcare assistant sort of seeing somebody in pain, going to speak to the doctor saying, this person is in pain, have you given them their pain relief? Bringing a jug of water for them, making sure that they are warm. The porter knowing if somebody has to go for a chest x-ray, then make sure they have lots of blankets on them. So I think, the tools are there. Today we've seen NHS England support, an education tool to help improve, training for people in emergency departments, and that is excellent. That is welcome. It will be nationally available, but we need the commitment from our colleagues in the emergency department to sort of participate in that training, and so it's chipping away, but it is absolutely crucial that happens, really.
Absolutely, and of course, as I think you've quite rightly say, that tool is so important and really does need to be cascaded right across the country and embedded into every hospital and every NHS trust. Victoria, if I can come back to you, you had sickle cell, or you've known you've had sickle cell, since you were young. Has there been, any difference in terms of your, communication with doctors and nurses from when you were young to an adult?
Yes and no, which is quite sad to say because I'm 40 now. But yes, in the sense that obviously, like I said, the first time that I was really having these pains and we went to the doctor with them, they kind of fobbed them off as growing pains. Right up until the point where now I can say that I have sickle cell to a medical professional, and depending on their speciality or depending on their level within medical industry, they will or won't know how that impacts what we're discussing. That's quite alarming to me because, it's there's no getting rid of it for us as it stands, in the situation that we're in. And I think I'm sure we'll touch on this, but the possibilities out there, the treatment that has been that they've worked so hard to get towards, to potentially curing people of this, further down the line. For instance, something like cancer, I'm being treated for it. So much money is put into it. It is recognized. People talk about it. People understand it. People know about it. But there may come a point once my treatment is finished, I never have to worry about it again. Whereas sickle cell is for good. Yet there's in comparison, such a small amount known about it, done about it. It's spoken about a lot less. So I think the conversations I have now with medical professionals, I try and just really drive that point home as much as possible. Like, look, this is potentially for life. So this is what I need to be focusing on too.
Yeah, absolutely. Of course, feel free to, jump in, all of you, and if you've got any comments on what anyone else has said. But Michelle, when talking about conversations, it's not just about between people who have sickle cell and healthcare professionals. It's also within the family as well. And how do we encourage more conversations within the family setting?
Yeah, because there is still a lot of stigma. In some cultures, there's lots of blame. There'll be blame towards the mother. So even though it's a genetic condition which requires both parents to have carried the gene, and this goes back to lack of understanding, so lack of education, even within communities that are affected by it. So we do need to be open and talking frankly and educating ourselves.
Yeah.
As Victoria described, even as a child, she felt the need to shelter her mother and protect her mother from what she was experiencing. Whereas now we have in the UK, thankfully, newborn screening of all babies. I think the number is about 270 babies a year are born with a condition. That's one in every 2,000 live births. So it's the largest growing genetic condition, and we've got to provide support right from the beginning. So right from that early diagnosis of basically, what the implications are, what it means to have the condition. And again, that ongoing dialogue. So then as a parent with a child, it's not just in discussions around sickle cell, again, going back to what Victoria described, it will impact every interaction with healthcare, particularly if there are other unrelated operations, because there are consequences to having these, red blood cells which react differently. Yeah. So the dialogue is so important for the communities, the individuals affected, to also take ownership and to have that courage to have that dialogue and do that bottom up education in healthcare settings, don't make the assumption that health professionals have all the answers, are skilled and experienced. Absolutely, haematologists, the clinical specialists, absolutely. But outside of that, we have to have the confidence to actually say, do you understand what sickle cell is? Do you understand the implications? And again, as Siobhan has said, if need be, call in your haematologist to help you have those conversations with those professionals.
That's exactly what I had to do.
Yeah, go on, tell me a bit more, Victoria.
Well, when I was, I know it's slightly off topic, but when I was diagnosed with my breast cancer, they were ready to do the surgery within a week. And then when my haematologist spoke to me, he's like, absolutely not. we have to give you a full body blood exchange before you go under that anesthetic, so that you come out of the anesthetic. So, he saved my life, essentially. And I guess, don't get me wrong, I'm so grateful for all of the medical team that have got me through this. But had that intervention not happened, then this could be a very different outcome, because we could have just gone ahead with it, because obviously you want to get, it's important to get the tumor or whatever it is for anybody out of your body. But it was so crucial for me to have that. And this medical professional was incredibly educated and brilliant at what they do, but they were a breast cancer surgeon. They didn't specialize in hematology, and they didn't know enough about sickle cell to put that into place. So for me, that's exactly where, like you say, bringing in your hematologist can be life-saving. And so thankfully that then lasted, and that full body blood exchange then lasted throughout the entirety of my recovery period as well, so that I didn't go into crisis, so that I didn't have chest syndrome or acute chest syndrome, all of these complications that can evolve after surgery. They were held off essentially because the fresh blood, the good blood, was doing its job in my body. So that for me that is exactly case in point. And like I said, it pretty much saved me. So
that reminds me actually of the other need to have these community-based conversations, because what we do know is that there aren't enough African and Caribbean blood donors. And it's those donors which absolutely have helped to save your lives and countless others. So again, the Sickle Cell Society have the Give Blood, Spread Love campaign, which is specifically around having those conversations, that understanding of the importance of African Caribbean heritage blood really being lifesavers. So it's not just about addressing the pain, which blood transfusion is again effective at doing. It actually prevents further complications taking place. And these complications, so we talk about the pain as a manifestation of the symptoms, but actually underneath what's going on is that those organs can be deprived of oxygen, which can lead to strokes, to heart attacks, to multi-organ failure, to fatalities.
When it comes to blood donations or the lack of blood donations, from Black communities, what are the barriers that are really holding people back, and what can be, what messages can be promoted out there, which I'm sure are, but perhaps even to a greater extent, which actually give people the confidence to give blood.
Barriers will include, again, fear of needles, fear of hospitals, not appreciating the importance. They might think, oh, it's just about whether you're A, B, O, and not fully understanding that actually we're looking at ethnically matched blood for the best outcomes. Only this week I learned, because again, this happens to be, National Blood Week and blood donation, is that African Caribbean blood, 50% of the donors will have what's called roe blood, and roe blood is very helpful for the treatment of sickle cell, whereas in the white blood donors, only 2% have this row blood. So
Mhm.
2% versus 50%. And I hadn't appreciated
Mhm.
that fact. So it's that education that actually it's the ethnically matched is the key. Don't leave it to other people, step forward. The other thing that had previously been the case was that individuals who had the sickle cell traits, so just one 40 gene as opposed to two 40 genes, and were told that they couldn't give blood. That's now not the case. So we can actually have more donors from the people who are sickle cell trait carriers. So lots of opportunities. So again, give blood, spread love.
Yes, please.
Siobhan, do you want to also, I mean, particularly for people who, you know, are maybe tuning in that don't have sickle cell themselves, you know, demystify, you know, that the point that Michelle made in relation to the types of blood which you know can and you can't donate.
So most people would know about the AB blood group system, and that's the main ones. But patients with sickle cell disease can develop what we call antibodies. So if you have blood from somebody, if you receive blood and that contains little particles on the red blood cells that you don't have, your body makes little signals to destroy those blood cells. And the more often we do that, the more difficult it is to get compatible blood. The shorter there is a shorter survival for that. And historically, as much as 30% of people with sickle cell disease who had a blood transfusion had antibodies. So we get better at matching not only the big blood groups, the AB, but the other ones, which are some of the other blood group systems. We know historically over a period of time that we are using blood transfusions for more indications now with sickle cell disease. The evidence base is getting better. So as the indications become more, the need to have suitably matched blood becomes greater. We are learning more about sickle cell disease, both from a laboratory element. We have better outcomes data now. We know a lot more about various complications that we could then intervene. So that the landscape is very different now compared to when I started training or when I became a consultant 15 years ago. So the options we have available to us, the types of situations are very different. And yes, we do need people to come further forward. It is the needle is only there for a short period of time, but you could really save somebody's life.
Mm-hmm.
Those are the true heroes, the people who come further forward to donate blood. Our first group of heroes must be the patients, though, because they have so many complications in almost every organ, in a condition that can just suddenly halt their day-to-day lives, as I'm sure Victoria can attest to. So they are our number one heroes, and then our number two and equally important heroes are our blood donors that we desperately need to come further forward to help support the changes in treatment that we have implemented.
And if I could just to add on to that and to show the importance of it, and please both correct me if I'm wrong on the numbers, but the red blood cells of somebody without sickle cell live roughly 100 to 120 days. Somebody with sickle cell, their blood cells live roughly 10 to 20 days. That's right, isn't it?
That's about right, yes.
So that just shows you how hard somebody who has sickle cell, how hard their body is working all the time, and how important it is that these donations are given. Because without even realizing it, and without me being able to thank that person, someone out there saved my life that day when I had that transfusion. And that's what this is. And it's so, it's great, so I don't know, you see somebody running into the street and there's a car or a bike coming in, you can pull them out of the way. That feeling, I know that it's physical and it's instant and it's there, but it's the same. You're still saving somebody. And so just that comparison of the lifespan of blood just shows you how important it is to donate, and actually really easy. And I've heard you get cookies as well.
A
who
bit of
doesn't want
squash.
who doesn't want cookies and some juice or milk, you know? So there's a
But
plus
it's really
side.
important that you highlighted that, because actually you've given two examples there, Victoria. So one about that kind of one-off significant operation taking place, and presumably it was because you had a well-matched pool
Exactly.
that it carried you all the way through.
All the way.
But there are some individuals with sickle cell whose anemia is so bad and so severe, and their crises so recurrent, that they're looking at blood transfusions every 3 weeks.
Yes.
So at the other side of the scale, you've got people that literally it's a lifeline on a ongoing basis.
Yeah.
So yeah, and the shortage is very acute, very significant, which is why we're wearing red today, myself and Siobhan.
And a question to any of you here, but we've got this Code Red campaign now that the artists have launched, which includes a guide to how to talk to healthcare professionals, and I assume that will also be useful in terms of talking to other professionals as well. Because the kids talk to their teachers. The teachers need to know a little bit about sickle cell as well. So, how useful do you think this will be?
So, to our patient who comes to clinic with me, then we are starting off at certainly starting off at a different point. Then I think that's this incredibly important, and that we start having those meaningful conversations. So knowing what things to ask, if there are things that you want explained, then certainly ask those questions. And it may be, say, for example, something as simple, well, why, remind me again, why do I have to take folic acid? And that's the same because of that red blood cell survival, So it's a good starting point to prepare somebody when they are in their consultation. Okay, what things do I want to get out of this consultation? And then for your healthcare professionals who are having that consultation with you, we can help address those things a little bit better. So I think it certainly helps prepare people for those meaningful conversations that we need to have. Be it your doctor in ED, be it your consultant in clinic, say, for example. And there's one thing I just wanted to add from Victoria's point about her breast surgeon. Yes, we really need, even all the other non-hematologists, their knowledge about sickle cell disease needs to increase. When the patient says to you, "This is not my sickle problem," so sort of believe it. My heart, whatever other condition, sort of believe that, and so again, listening to patients, again, really important. And having those tools, again, another way of helping that dialogue is to maybe have your advocate in with you. So you may not be able to remember certain pertinent questions, or be it a friend, a family, say, for example, because ultimately the person who at the center of all of this is our patient. We want better outcomes. That's a unanimous goal for us all. Your healthcare professional, your family, yourself, all we want is for you to be well, and let's work together to help deliver that.
Michelle and Victoria, do you have any other tips for our listeners?
I would go back to the advocacy part as well, because again, if you're not in the crises, it's much easier to have those coherent conversations and to be understood and to be listening. In very acute pain and anxiety, panic and fear, actually having a trusted advocate with you. So again, if they can be prepared in advance of an emergency situation around the types of conversations to be had. So absolutely to reference back to the Code Red website in advance of the needs for yourself and your advocate, again, could be a lifesaver.
Yeah, I mean, I think I'm really, really honoured to be a part of this campaign, because I think it's going to help so many people with and without sickle cell. And as both of the ladies have said, it's just vital that we get that sense of community out there, so people feel that they're, the information is there, but also other people understand it, because it can be incredibly lonely, I think, when you're facing day to day the struggle of having something that nobody understands, nobody gets. And so that is a huge part of it, because it can affect your mental health as well. As a lot of people I've spoken to have really struggled with just feeling normal. And everybody, you know, we all have the basic needs and wants to be loved, to be understood, to be cared for, to do all those things for somebody else. I think that as far as a tip goes, when it comes to the hospitals, A&E, stuff like that, I always carry around my card. There's the hemoglobin card that I have, but I think on top of that, which I don't do, but just having this conversation, which is why I love these conversations, has made me think of, is just having something alongside that that explains what you need in case you can't verbalize it, because sometimes the pain can be that bad. It can be the name of your hematologist. It can be your need in a certain way, as far as the fact that you need to stay warm, you need to stay hydrated. Don't put me near a window or where there's aircon blasting at me, or, you know, bring me some water. I need the pain now. And I get that I'm not bleeding at the moment, but the pain is excruciating, that kind of thing. So maybe just a small something that you keep with you in your wallet, even in your phone, if needs be, you know, just something that somebody, you can show it to somebody and they can read it, so that they can fully understand your needs if you can express that in that moment. But the main thing is talking about it with everybody from as younger age as you possibly can, with anyone and everyone, sharing as much as the information, because education is key, and as we know, knowledge is power. And then across the board, empathy is just crucial, and that's what it is. It's empathizing with something that just might never have even crossed your mind before.
Well, thanks so much, Victoria, for those really important words, and thank you obviously for supporting the campaign, being part of it here and sharing your lived experience. Fantastic thanks too to Michelle Salter, chair of the Sickle Cell Society UK, and of course Dr. Siobhan Pancham from Solihull and West Birmingham NHS Trust. Before you will go, I'm just going to share my screen there. This is the website for the Code Red campaign by Novartis. The website address is all the W's switchuponsicklecell.co.uk. This is a new site, so I think it went live today. So it's brand new. I'm going to once I just finish my last bit of my last few words, I'll put up the whole screen again, which has both the website address for this fantastic site and also for Sickle Cell Society as well. The disease campaign Code Red has been created and funded by Novartis Pharmaceuticals UK Limited. This Facebook stream that you've been watching is part of that campaign. All participants have been engaged by Novartis in relation to the campaign to share the stories, and unless otherwise stated, everything that our wonderful guests have said is their own views and experiences and expertise, of course, and any materials posted as part of the Code Red campaign have been approved by Novartis, are labelled as such. So it just falls to me now to thank you for our special guests, and also thank our audience as well who've been watching this. Happy World Sickle Cell Day to you. Do make sure that you share some content on social media sites, supporting both the the work of Sickle Cell Society and everything else that is worth sharing, including the Code Red campaign. So thank you very much. I'm pleased to be invited to chair this session, and I've learned a lot as well. So thank you all. And
thank you for having me.
have a great Sunday.
Bye.